Now featuring the Class 3 antiarrhythmics, the potassium channel blockers, the Tres Amigos. During the performance, I want you to pay special attention to that banana-themed stage curtain. Remember that this curtain represents the potassium current present during the plateau and repolarization phase. Well, Class 3 antiarrhythmics block these potassium channels, allowing the myocardium to be depolarized for longer. As the curtain gets thrown aside, remember that inhibiting this potassium current causes a prolongation of the action potential. And this is the action potential of the cardiac myocytes and conduction pathways we're talking about here. This is not that nodal calcium action potential, which is affected by Class 2 and 4 antiarrhythmics used for rate control at the SA and AV nodes. Class 1 and 3 are a little different. They're used for rhythm control. Let's introduce our Class 3 antiarrhythmics now, the mariachi trio Los Tres Amigos. Notice the fruity pattern on the curtain being pulled back to give our mariachi band a more dramatic entrance. The shape and pattern of the curtain should look familiar. Recall from our video introducing the Class 1A antiarrhythmics that the broad, flat lower edge of the curtain represents the Phase 2 plateau, while the dropped edge of the curtain represents the Phase 3 repolarization to close out that action potential. This is the cardiac action potential found throughout the atria, ventricles, and His Purkinje fibers. The potassium banana theme on the curtain represents the presence of an outward potassium current, gradually increasing during the plateau phase and working in full force during the repolarization phase. Class 3 antiarrhythmics exert their antiarrhythmic effects by blocking these potassium channels in the myocardium. Notice how the last mariachi grabs the curtain and throws it aside. Blocking potassium current prolongs Phase 2 and Phase 3 of the action potential, and hence the length of the refractory period. However, amiodarone is different than the other Class 3 antiarrhythmics. Besides blocking potassium channels, it also blocks inactivated sodium channels, kind of like Class 1 antiarrhythmics. Amiodarone also has weak beta adrenergic and calcium channel blocking effects, similar to Class 2 and 4 antiarrhythmics. What? So it's like all the antiarrhythmics in one. Let the amigos count in before each song. 1, 2, 3, 4. Remind you that amiodarone shares properties of Class 1, 2, 3, and 4 antiarrhythmics. You know, what's more romantic than a night of melodious mariachi music? The lights are dim, the atmosphere festive, the food is above average, for sure. Yep, it's the perfect time to pop the question to that certain special someone. Let this note from her future fiancé, Till I Die, remind you of the suffix tillide, shared by both difotillide and ibutylide, two other Class 3 antiarrhythmics. And here's the man of the hour, nervously awaiting her response. So nervous, in fact, he awkwardly sets down his muted bugle, knocking over one of the bottles of soda, the drink of lovers. Soda should remind you of the drug Sodalol. I don't always drink soda, but when I do, I prefer Sodalol. Notice the lol suffix of this Class 3 antiarrhythmic. It sounds kind of like a beta blocker, right? Well, it turns out Sodalol exhibits both the action potential prolonging effects of Class 3 and the beta adrenergic receptor blocking effects of Class 2, which is why our proposer over here is nervously holding a muted beta-shaped bugle, the recurring sketchy symbol for beta blockers. Alright, to set the mood, the restaurant owner has lit some heart-shaped candles and laid them out on the tables. The top atrial half and the bottom ventricular half of these heart lights are illuminated, to remind you that the action potential prolonging effects of the Class 3 antiarrhythmics can be used to suppress both supraventricular arrhythmias as well as the life-threatening ventricular arrhythmias. A specific supraventricular tachycardia that can be treated with these drugs is atrial fibrillation. The recurring sketchy symbol for AFib is this irregularly irregular static signal on a television screen, this time hanging in the corner of the restaurant. Recall from the Class 1 antiarrhythmics video that those Class 1C drugs were useful for rhythm control in AFib. Well, these Class 3 drugs are also highly effective for restoring and maintaining normal sinus rhythm. And notice that the restaurant owner points the remote at that irregularly irregular static, hoping to convert it to a channel with a normal rhythm. Let's shift our focus back to the amigos, who represent that antiarrhythmic with a broad spectrum of action, amiodarone. Most of the questions you'll see on the exam will not focus on the clinical indications of this drug, but instead focus on the equally broad spectrum of side effects, which have been described in virtually every organ system. The drug accumulates in many tissues, including the heart, lung, liver, and skin. Let's go through these side effects from head to toe, starting with the brain. Symptoms of neurologic toxicity can take many forms, including tremor, ataxia, peripheral neuropathy, and sleep disturbances. And notice that there are some intricately embroidered toxic skull brains on the amigos sombreros. Within weeks, gray corneal microdeposits will develop in virtually all patients, as represented by these gray sunglasses blocking the corneas of the three amigos. These deposits are usually asymptomatic, but may rarely cause halos in the peripheral vision, optic neuritis, or blindness. Amiodarone is 40% iodine by weight, so it's a potential source of large amounts of inorganic iodine, which can cause hypothyroidism or hyperthyroidism. The thyroid is that bow tie-shaped gland in front of the thyroid cartilage at the top of the trachea. Look closely and you'll see that the bow ties worn by our amigos are of various styles, from large to small to completely untied, representing the variable effects on thyroid function. Remember to evaluate thyroid function before starting a patient on amiodarone and to obtain regular thyroid function tests. The most important side effect is a dose-related pulmonary toxicity that can lead to fatal pulmonary fibrosis. See the pattern embroidered on the lapels of the mariachi uniforms? It's a sort of intertwining fibrous pattern. Also notice that one of the buttons is closed on his jacket, barely holding on under all that tension. This is to emphasize that pulmonary fibrosis leads to a restrictive lung disease. Because of its class 2 and 4 action of depressing conduction through the atrioventricular node, amiodarone can potentially cause heart block. And notice that the top of this mariachi's hat is sort of shield-shaped, blocking his heart as he holds it against his chest. Amiodarone has numerous other cardiac effects, including heart failure, especially with rapid IV administration. We will symbolize these other cardiac effects by tossing in some floppy, failing heart balloons, trampled by the amigos on the stage. Abnormal liver function tests and hypersensitivity hepatitis may develop during amiodarone treatment, so liver function tests should be monitored regularly. Outside, joining in the serenade, is a cow, marked with our recurring sketchy symbol for hepatic effects, a liver-shaped spot. The skin deposits result in a photodermatitis and a gray-blue skin discoloration in sun-exposed areas. So let's change our trio's outfits to an alluring gray-blue color. As a photographer rushes in to take pictures of this momentous occasion, let the flashes of his camera emphasize this photodermatitis. Lastly, amiodarone is an inhibitor of liver cytochrome P450 and may increase the levels of many drugs, including statins and warfarin. So we'll add a rusty, dented chrome bumper to the trailer holding the cow singing the backup vocals, with an old beat-up P450 license plate, the recurring sketchy symbol for P450 inhibition. On the ECG trace, the QT interval represents the time required for ventricular depolarization and repolarization. Therefore, all drugs that prolong the cardiac action potential, in other words, all drugs that throw aside that potassium curtain, including class 1A and all class 3 antiarrhythmics, will cause prolongation of the QT interval. Prolongation of the QT interval is associated with a form of ventricular tachycardia called torsade de pointe, or polymorphic ventricular tachycardia. Although amiodarone can significantly prolong the QT interval, it has a low incidence of torsades, possibly due to its ability to block a wide variety of ion channels. In contrast, sotalol, dofetilide, and ibutylide cause QT prolongation accompanied by a dose-related incidence of torsades. Therefore, we'll keep the party centered on our two lovebirds in the foreground and drape twisted party streamers with the torsades EKG tracing around both the sotalol soda-drinking guy and his dofetilide tilidie fiancé. Okay, I think we should give them some room, so let's quickly sum up the important facts of Class 3 antiarrhythmics. While Class 2 and 4 agents are for rate control, meaning they affect calcium current at the SA and AV nodes, Class 1 and 3 antiarrhythmics are for rhythm control and affect the cardiac action potential in the atria, ventricles, and His-Purkinje system. As they pull back that banana curtain, remember that Class 3 agents block potassium channels and prolong the cardiac action potential. This can lead to prolonged QT and torsades, hence the twisted torsades streamers. Amiodarone, represented by the three amigos, is a little different than the other Class 3 agents. It exerts effects similar to all antiarrhythmic classes, 1, 2, 3, 4. It's also riddled with adverse effects, many of which are highlighted by the mariachi band. Tilidie, dofetilide, and sotalol soda are a couple more Class 3 agents in the front, next to a fully lit heart lamp to remind you that these agents are useful for managing both atrial and ventricular arrhythmias. AFib specifically can be converted to normal sinus rhythm. Alright, let's head over to the Class 4 antiarrhythmic sketch for some calcium ice cream, the perfect end to a perfect night.